Distal radius volar rim plate is used to treat intra-articular distal radius fractures involving volar rim, volar shear/Barton fractures, and marginal rim instability patterns. Comminuted distal radius fractures requiring distal fragment buttressing and corrective osteotomies. High-energy trauma, road traffic accidents, sports injuries, with axial load and volar shear forces causing marginal instability. Low-energy falls, FUSH, osteoporotic falls, producing intra-articular fracture patterns. Specifically designed for complex distal radius fractures involving the volar rim. Anatomically contoured with low-profile design for optimal fit and stability. Subchondral buttressing of distal fragments is provided for proper articular support. Flaps can be bent up to 15 degrees to accommodate chip fractures and variable anatomy. Variable angle screw placement is enabled through AV-Wiselock screw holes. Precise articular alignment is maintained with minimal soft tissue irritation. Position the patient in beach chair position with the forearm supinated. Reduce the fracture using a method appropriate for the fracture type and temporarily stabilize it with K-wires. Use a K-wire to provisionally position the distal radius volar rim M plate on the fracture site. Place the 1.5/1.1 mm double drill guide on the bent flap. Create a unicortical hole using 1.1 mm drill bit quick coupling through guide. Use the depth gauge measuring up to 30 mm to measure the length of the 1.5 mm cortical screw. Attach the 1.5 mm cortical screw holding sleeve to the 1.5 mm star screwdriver and load the measured length 1.5 mm cortical screw. Insert the screw into the pre-drilled hole. Repeat the process for the second flap. Once the flaps are fixed, move towards the oblong hole of the plate. Drill through the oblong hole in the plate shaft using a 1.8 mm drill bit with the 1.8/2.4 mm self-centering double drill guide. Use the depth gauge measuring up to 60 mm to measure the 2.4 mm cortical screw length. Assemble the 2.4 mm cortical screw holding sleeve with the star head screwdriver. Attach the 2.4 mm cortical screw to the cortical screwdriver assembly. Insert a 2.4 mm cortical screw into the pre-drilled hole. Achieve compression with the final tightening of cortical screw. Place the cone-shaped end of the 1.8 mm universal AV-Wiselock drill guide into the AV-Wiselock hole of the plate. Drill through the guide at desired angle using 1.8 mm drill bit for bicortical hole at variable angle. Use the depth gauge measuring up to 50 mm to measure the 2.4 mm variable angle screw length. Attach the handle for torque limiting attachment to the 0.8 Nm torque limiting attachment and T8 star screwdriver shaft. Screw in variable angle screws using variable angle screwdriver assembly. Repeat this procedure for the remaining AV-Wiselock head holes with 2.4 mm variable angle screws. Remove the K-wires from the bone and plate after completing the fixation. Distal radius fracture reduction using Oxion's distal radius volar rim M plate completed. Immobilize the wrist in a splint or brace for initial soft tissue healing. Initiate gentle finger and wrist range of motion exercises as tolerated in the early phase. Gradual progression to active wrist mobilization after 2 to 3 weeks. Begin strengthening exercises once fracture stability is confirmed.